In a recent survey, just 14% of students said they were satisfied with life. The same survey asked around 14,000 students nationwide. So what is it about student life that means so many young people suffer with poor mental health? They can be some of the loneliest people in the country.
People always ask me what it's like to be suicidal and really depressed, and I just say it's like you're in a room with four walls and it's just black.
Feeling isolated more often and more intensely than any other age group.
Going through it at the time, it was definitely more challenging than I thought it would be.
I'm not talking about elderly people who live alone. I'm talking about university students. A recent survey found that 1 in 6 students have no true friends, and nearly a third feel lonely on a weekly basis. It's a problem we hear about in just about every walk of life. But what is it about being a student that can be so damaging to your mental health? Paige came to Sussex Uni in 2016 to study drama. She'd already experienced mental health problems as a teenager, but says it got 10 times worse when she went to uni.
I just found it really, really stressful. I actually hated it at first, and it just made my mental health go completely down. I started self-harming. My medication had to be doubled. I started having to go to weekly therapy, missed all my classes, really, really fell behind. And when I started falling behind, it was extra pressure because I wasn't keeping up. I didn't leave my flat for a month.
Levels of mental illness amongst university students are increasing. The amount of first-year students, freshers, who say they've had a mental health problem increased by 5 times between 2006 and 2016, the year I graduated. That's according to the Institute for Public Policy Research. I went to meet the newly elected president of the University of Sussex Student Union, Philip Vasilevich, for a chat. He says mental health issues are commonplace.
It's a big problem among student population in general. Most of the people that I know and friends with have experienced some kind of mental health difficulty while being at university, whether it's just mild anxiety to very severe forms of mental illness, with university being more competitive and essentially constantly being told like, oh, if you don't get at least a 2-1, then why did you even go to university?
And you've seen that with friends of yours?
Oh, 100%. So speaking of, even myself, I've had mental health issues while studying, and it's all being compounded by a lot of different things.
And this isn't a problem that's unique to the University of Sussex. Callie Akande moved from London to Nottingham to go to university.
It's been an experience, I would say, and it's definitely changed me quite a bit. For the good, as well as alongside all of its challenges. Going into uni, I was pretty much excited, and I knew that I was going to make the most out of it, which I did. Like in year 1, I was actually nominated most active fresher. I got involved with men's societies and everything else. And I think it pretty much changed in year 3 when my course actually became quite difficult. It was quite challenging. There wasn't really enough time to socialise or to continue the activities I was doing in year 1 and 2. I spent a lot of my time actually studying, and then the only time I could actually enjoy myself was summer, and that was the year I actually decided to do a placement. So I went straight into work. Again, I was having to sacrifice being with my close friends on my course, and knowing that I would come back to uni and be not alone, but with less of my friends around.
So we know it can be difficult for students coming to university. It's often the first time they've lived away from home. There's also the added pressure of making friends, living independently, and keeping up with work and lectures. When I joined university back in 2013, I remember panicking about the amount of work I had to do. Mental health support wasn't something a lot of people were aware of, even if it was there. And according to Paige, that's one of the main problems.
I've turned up to a lot of events around this area, and a lot of people say, we need this, and I'm like, we do have that. Students just don't know what's out there, and I think it's something I flagged up so many times, and it's something that they've taken notice of and are starting to work on, because it's such a simple thing about a little bit of communication. So the word is getting out there.
There are organisations separate from universities that help students. There's charities like Mind, Sane and the Samaritans. But what about the universities themselves? What are they doing? Well, I approached several in our area. 2 of them decided to speak to me. Here's Laura Smithson, Deputy Director of Wellbeing at the University of Surrey.
we're able to provide some really good clinical input with our counselling and advice teams. So we do a lot of face-to-face work with our students. We run workshops. We also are able to do a lot of training for our staff and students in mental health awareness.
I also spoke to Dave Corcoran, Director of Student Support at the University of Chichester.
It's a whole range of support that we have in place, and that goes from before students arrive here, and then for other students, some of the concerns that may emerge in time when they're on their course is then, we will work with students then at the time of that emerging. We try to be as proactive as possible.
Here's Flip again.
I think that Sussex is doing okay, but I think it could be doing better. The counselling services are under a lot of pressure because they're so overworked. There are so many students that are trying to access the counselling services. They don't have enough counsellors. They don't have enough just space to have extra counsellors, to have the rooms, whereby a friend of mine who was essentially in a crisis and kind of needed a relatively urgent care waited about a month and a half to receive the first kind of appointment.
Sussex Uni spend £3.5 million a year on student welfare, including mental health. They sent me a long list of services that students can access, including counselling, free and confidential support through the Student Life Centre, and initiatives like group therapy and drug and alcohol drop-ins. But where most people agree the power to make change really lies is with the government. I managed to track down the former Home Secretary and MP for Hastings and Rye, Amber Rudd. I asked her what she made of the startling rise in the numbers of students suffering mental health conditions.
I'm acutely aware that young people live in a life where they have additional pressures on their lives. That can be to do with challenges at university. It can be to do with challenges they experience on social media. And we as a government need to make sure that we recognise that and give more support to local services to support young people. One of the services I visited last week as part of my mental health day, as it were, was the IROC Centre, which has also benefited from new cash. It's local to Hastings, and it helps young people explain what challenges they have and how they can overcome mental health difficulties. It's got a professional element, but also a peer-to-peer element. So we're acknowledging these difficulties, and I'm making sure, as the local MP, that we get the support we need.
Today's generation of young adults are exposed to a unique set of challenges. We're the Instagram generation, Generation Rent, a bunch of millennial snowflakes that have it easy. Well, one thing's for certain, mental health problems are on the rise. And if there's one thing we can do, it's talk to each other. I'll let Paige have the last word.
The minute you notice something wrong, and if you notice something wrong in someone else, don't be afraid to ask. A lot of time people just want to be noticed and be asked if they're okay.
I'm saying I'm lost, still wondering my cause, still, cause I got